Okay. Well, great. Well, thank you everybody for joining us. My name is Dr. Mary Barraza. I'm a family medicine physician working for We Care in Attica, Indiana, a tiny little rural community. And I am just delighted to bring some awareness to mental health today with you all. You can do the next slide. Perfect. So our agenda today, we're going to review, again, we all know, but why it matters. Why does mental health matter? Understanding more of a broad scope of a mental health definition, not just diagnosis wise, but mental well-being. We'll be looking into some healthy ways to cope and prevention. And then a little bit more of the meat of the presentation will be spent on what's called cognitive distortions, which I find was a very interesting topic to review and super helpful for helping me explain to some patients ways to optimize our mental well-being. We'll leave some time for question and answers. I'll have a slight disclaimer here. I am a family medicine physician, so that's the extent of my mental health training. It was in a family med psych program type training. I did not pursue the psychiatry part, but I think more of my mental health information comes from a lifelong daughter of a licensed counselor, my father. So I feel like I get a lot of that information from him. We'll go into now why mental health matters. So I think we've gotten a good understanding of why it matters for our mental well-being, but I want to point out a couple things here with why it matters also for our physical well-being. So those with mental health illness have a 2 times higher risk of cardiometabolic disease than the average population. And specifically, people with a depression diagnosis have a 40% higher risk of developing cardiac disease, hypertension, stroke, diabetes, metabolic syndrome, or obesity than the general population. It doesn't just stop there. It leads to a third of those people having substance use disorders, which is a huge tax on their lifelong, and on our society. And it affects the mortality of these people, with 1 person dying by suicide every 11 minutes in the US. We've gone a long way for allowing mental health awareness in this society, but we still have a lot more, which is why I love that we devote our May month to mental health awareness. So even without a mental health condition, we still, I want to say that this is more than just a diagnosis, right? Like, we are showing that people who without depression, without anxiety, are reporting half of them are burnt out at their job. 3/4 of them are feeling moderate to very high stress at work, and almost half are feeling emotionally drained. And so I think a lot of us will say, oh, it's fine. I work to live on the weekend. I can get through the work week, and then I live my life on the weekend. And that's just life. That's just what we do. Pull ourselves up by the bootstraps, right? But I do, and mental health is not just saying, hey, you have depression or anxiety. It's how you cope with your whole surroundings. And so next slide will show a little bit better what I'm getting to. I think if you can say, hey, I just have it at work, but then you think it doesn't affect the rest of your life, I would challenge that, because then if your mental health isn't optimized, you're not handling stress as well. You're not able to communicate with your friends, your family, your spouse, your children as well. Processing challenges become harder. The way we view ourselves, our self-image, and let's be honest, our kids pick up on that kind of stuff, right? Our spouses deal with that too. And so if our mental health is not optimized, it really does permeate both in work and after work. So someone might be wondering, well, what are the warning signs? How do I know? I know if I'm depressed. I know if I have severe anxiety, but what are some of those signs that maybe my mental health is just starting to decline? A lot of us can kind of see some of the emotional signs present. We talked about those on the last slide. The way we communicate with others might be a challenge. The way we handle our stress, maybe we're more short-fused. Maybe we're having trouble focusing. That's where I kind of want to go into the physical signs, is where we see a lot of people shocked by the fact that they'll come in and they say, hey, doc, I have a headache. I'm not a headache person, but I have had daily headaches now for the last 6 months. And wow, we need to work up everything, right? One of the most common things that I'll tell people and ask about is our mental health status. That is the same approach for our fatigue chief complaint. Depression and anxiety are a big contributor to that too. People who have middle of the night awakenings, that can actually be a huge sign of anxiety. Your appetite changing. I tell my patients all the time, a lot of the same chemicals that are in our brain are actually in our gut too. And so if our brain mental health is not doing well, our gut can be all awry. We can have bloating, diarrhea, constipation, lack of appetite, or too much appetite. And I don't know if that's as well aware for our patients to know these physical signs can be just as telling for our mental health optimization. And then on the behavioral side, signs, the one I want to point out is the difficulty focusing. I think we'd all agree that ADHD awareness has been much better over the last decade. But in some ways, I think maybe where we're faulting as a society is reminding people that focusing is a sign, good focusing is a sign of optimal mental health. And so if we're having trouble focusing, well, maybe it's not a true diagnosis of ADHD, but maybe actually it's that we're not optimizing our sleep or our our mental well-being, because you see in those emotional signs column that if we're not processing challenges well, we're probably not going to be able to focus well. Or if we're not handling that stress or the fast pace of what's being thrown at us, we might not be able to stay on task as well either. If our sleep and the physical signs is off, or we're not eating consistently, or we have a headache all day, well, those would all be reasons why we can't focus as well. And so I think it all really does intertwine together. Next slide. So a question would be, well, okay, how do we get there? How do we optimize that health? What's some healthy coping strategies? What's some preventative measures we can take? I am a huge proponent of sleep. I definitely was thinking about doing OBGYN in my early years, learned that schedule pretty quickly and thought, nope, can't be doing OBGYN. I need my 8 hours of sleep. So that is a huge thing to prioritize. We know that if we're feeling like we've only had 1 or 2 hours of sleep, we are not handling stress as well as when it comes in. I think the boundaries are a really good one to discuss. Without a set boundary of time away from stress is going to start feeling constant. And so it's very similar to that concept of, well, there's a light at the end of the tunnel, right? If I can make it to the weekend, I'm good. I have that time to rest. But I would challenge the person and say it's wise to get that boundary set for time away from stress, even daily. So set aside that time for lunch. Don't try to work through it consistently. Set aside a time for 15 minutes of music in your car as you drive home, or whatever recharges you as a person. Get that boundary in there daily so that you don't feel like the stress is absolutely taking control, and that you do know and you are reassured there's a break every day in that amount of stress. Movement, exercise, we always talk about how important that is, but you don't have to run marathons. You don't have to have knees that are working perfectly. What I'm talking about movement with mental health, it's as simple as like Tai Chi. If you've heard of Tai Chi, it's those real rhythmic, smooth motions with your arms. You're getting toning in that way, but it's a really great way for mental health too. And it doesn't take a lot of physical ability to do Tai Chi. So that's a very simple movement you can do to optimize. Connection, we went through a huge human experiment during COVID, I'd say, of what isolation will do to a person. And it's not good. Mental health disorders surged after COVID, and I think that's a huge part of it. So we are relational beings as humans, and that is absolutely going to contribute to whether we're feeling better or not. I'm going to skip the mindset for the last one, but asking for help and receiving help. I think in a world where we're being asked to do more for oftentimes less, it's more important than ever to use our resources, to use each other. And that's asking for help, but it's also practicing gratitude of getting help. And so that practice of gratitude can also really change the mindset that we're going to go into and change the way we perceive our environment. So the last one is mindset. And what does that actually mean? That's where we're going to go into our more bulk of the presentation. Mindset is going to be our perspective of how we perceive the world around us. when stress builds up, I think we can agree that the way we perceive something might be altered. And so sometimes we might jump to the worst case scenarios. We might become overly critical, interpret a situation negatively, and it can become, when it becomes automatic, when it becomes a pattern of thoughts like that, we call these cognitive distortions. Next slide. And so the true definition of a cognitive distortion is a biased or irrational thought pattern that distorts your reality and contributes to negative emotions and negative behaviors. I think the biggest question here, the most reality question here, is that what if the thoughts causing the most stress in our life aren't actually facts? We've automatically started perceiving something incorrectly. So that was a big eye opener for me when I saw this question. I'm thinking, gosh, if I don't have to have stress because something's false, why would I want to add that to my life? So we're going to go through some thought patterns that can become oftentimes automatic for people and common. But if we can learn how to slow them down and examine them, many are surprisingly unrealistic. Next slide. Some of the cognitive distortions that are out there, we're not going to go through all of them for time's sake. But catastrophizing, that is one we'll go over, so I'll define that in another slide. Mind reading is another one. Fortune telling is going to be assuming what the future holds, maybe based on past experiences, but we can never be sure of the fortune. So that's not a fact, and therefore we shouldn't rely on that for our entire perception. Overgeneralization, thinking that something is always going to be this way, or I'm never good at this. Those are dangerous words to use. Emotional reasoning we'll go over here in a little bit. Should statements can be pretty detrimental to our self-esteem. Oh, I should be more like my mom, or I should be doing this in my free time. There can be a lot of guilt that's associated with those kind of statements, and that doesn't lead to as much empathy towards oneself or grace. Labeling we'll go into, and then self-blame is a distortion where you blame yourself for somebody else's emotions. And so, Kelly over there had a bad day, probably because I didn't say hi to her. It's my fault. That would be an example. Then the goal of once you identify these cognitive distortions is to reframe them. There's 4 main ways to reframe, although there's plenty more out there. With each one of these cognitive distortions, if you find that maybe you're having some of them, actually Google does present a lot of options for reframing. If you type in catastrophizing, cognitive distortion, reframing, you can often get a lot of suggestions. And then of course a trained therapist is going to be the best for help on that. But most of the most common ones that a therapist will go through is a thought record. And on my next slide, I'll show you what that looks like. A Socratic questioning. So just like the philosopher Socrates, this is going to be examining your current beliefs or your current assumptions with a questioning method, kind of probing in on a deeper level of questioning to really get to the root of why do you think that? Is there any truth to that basis? And just challenging some of those thoughts. A behavioral experiment. So that is intimidating for sure, but it's basically taking one of those fears. Like, for example, maybe you say, oh, if I stutter during this presentation, I'll get fired. And so challenging that extreme thought would be, well, okay, maybe I'm ready. Maybe I'm confident enough to go ahead and stutter for 5 seconds or 2 seconds in my presentation and watch the reaction of my other people listening. And what you usually find is that it's not as big of a deal as you once thought. And so that starts to build that confidence of, hey, you can make mistakes and it's not going to be life ruining. So that's a type of behavioral experiment, but certainly that's oversimplified. There can be lots of those types. And then lastly, the perspective shift. And so that's asking for somebody else's perspective or putting yourself in the shoes of others to get their perspective. So you might say, well, what would my future self think about this scenario? Your future self might be more financially stable or more wise, less in a stressful situation. And what would they say about this situation? Or what would a loved one say about this, a trusted pastor? Also, you could even say, would I have said that statement to my best friend? Or was it such a harmful statement that I would never say that to them? If it's harmful to your best friend, it's harmful for yourself. So that would be another way to say, I shouldn't be saying these statements to myself. Next slide. So here's an example of a thought record. I was going to run through one option. So a situation that you could, sorry, let me back up actually. The thing about a thought diary, and for a lot of these reframing methods, is that you can't be doing this in the state of stress. So a lot of these are retrospectively. The reason I say that is because a lot of counselors will kind of break down red, yellow, green behaviors or emotions. When you're in the green, you're in the most likely state to be able to logically think. You're kind of in your cognitive state of brain, white matter state. When you're in your yellow, you're getting closer to that green or maybe closer to the red, but you're in between and you need to kind of examine which way we need to go. Then when you're in red, you're in a very emotional state. You're in your amygdala or your limbic, it's your emotional part of the brain, and you're not going to be able to think logically. So to get to the point where you can do the questioning method or to do the thought diary, you need to get yourself back into that green. And there's a lot of other counseling techniques that can get you there. But let's go from that thought that we're in the green. We've had a scenario and we want to look back at it. This situation is I sent my manager a report and she hasn't replied all day. So an automatic thought there would be, she must think my work is terrible. I'm probably going to get fired. That might be an automatic thought that somebody has, a cognitive distortion. You want to rank what your emotion and intensity of that thought is in that, or was in that emotion. Maybe you rate your anxiety was around 80% of getting fired. Your self-doubt might have been 70%. So then it's also helpful so you can start to see patterns of what cognitive distortion is identified. In this scenario, it's catastrophizing, assuming the worst possible outcome, and mind reading, assuming I know what someone else is thinking. Evidence for that thought would come next. So you might say, well, she hasn't replied yet, so that's evidence for my thought, and I did make a small typo in the report. But then you'd want to work through the evidence against. She's been busy with meetings all day, so she's probably not able to respond yet. She's complimented my work in the past, so this hasn't been an issue before. And a typo doesn't usually lead to being fired. So after you go through that logical process, you might be able to come up with a more balanced or alternative thought. Actually, she's probably just busy. If there's an issue, she'll let me know and I can fix it. One typo doesn't define my abilities. And after you say that a few times out loud, you can start to say, okay, what's my new emotion? Well, I'm maybe only 30% anxious and I'm about 60% confident now. So that's a way to work through that scenario and start to break those consistent or automatic thoughts. Okay, let's see, I lost my, 1 second. Okay, so moving on, we kind of hit the catastrophizing with that thought journal. But again, it's assuming the worst possible outcome will happen or viewing a situation as far worse than it is. If I don't answer this email perfectly, I could lose my position. My friend hasn't texted me back yet. My spouse hasn't called me on his drive home. Something must be seriously wrong. I'm sure we've had some of those thoughts in the past. Next slide. Other than the thought journal, what's another way we can reframe this? Well, again, identifying for catastrophizing is one of the most important things. Identifying, is this statement an absolute truth or is it an unproven thought? If we can say that it's an unproven thought, we can start to label it as that and then walk through, well, how likely is this actually going to happen? You know, how likely is it that somebody is in an accident on their way home, or how likely is it that you're actually going to lose your job? To make that decision, you might have to work through that thought journal of, okay, what's the evidence for or against? But hopefully you can come up with, okay, it's not that likely. Or if it is likely, let's say you've done a lot of things wrong at work and it's very possible you could lose your job with one more mistake in your mind, at least. If that's more possible, then the next step is to work through that worst case scenario. You know, what you'll find is maybe you have, it would be terrible, right? But maybe you have the coping techniques in the tool bag to get you to the next job. And so you start listing out those tools. Well, I have my resume done. I have references to use. I have, I've already looked into other jobs and this is what I would do. And so if that truly is an automatic thought that is perseverating and you can't get rid of it, sometimes you do have to go down that route of what would I do in that scenario, just to reassure your mental state that I have the tool back to get through it, right? Again, that doesn't work through everything, but it could be helpful. Mind reading is our next cognitive distortion, assuming you know what other people are thinking without actual evidence. Oh, they were quiet during the meeting, so they must disagree with me. My manager probably thinks I'm incompetent. They didn't invite me because they don't like me. Those are some examples. Reframing options of this, we've talked about the evidence, counter evidence idea. The new idea here in this slide is weighing the costs and the benefits of this, believing the thought. So I guess another way to say this is, how does it benefit you to believe the thought that somebody doesn't like you or that your manager thinks you're incompetent, especially if you don't have that evidence? At some point, you have to agree to say, it's not helping my self-esteem. I'm actually walking into my workroom with a complex because of it. And so if those are the statements or the answers to that question, then you might want to start looking into, well, is it really worth feeling that way? And if it's not, let's drop that thought. Whether it's true or not, let's drop it. Let's start replacing it with the thought of like, I matter, I'm important, and I want to feel better. So that's one thing you can do with reframing a mind reading. Overgeneralization. These are those big statements. I always mess things up. People will never understand me. Nothing never works out for me. It's kind of this never-ending pattern. Ways to reframe that: look for the exceptions and then write them down. That one's a really important one, to write down the exceptions so you can prove that the pattern is incorrect. Replace it with a balanced thought, especially with mistakes. Nobody's perfect, but you can acknowledge that I made a mistake this time, but I've done well in the past, and these are my examples of how I've done well. This is another one where it's helpful to ask a trusted loved one's perspective. Most of our loved ones have numerous examples of how they think the best in us. And so if you are not in a position, maybe depression is settling in quite a bit at this point, somebody else that loves you very much is going to be able to recall what you've done well and help start forming that list of exceptions for you. Two more, so bear with me, guys. Labeling is the next one. This is assigning a harsh negative label to yourself or others instead of describing the situation objectively. Gosh, I'm so stupid, or man, he's a complete idiot. I'm such a failure. These are some pretty strict comments here. So ways to reframe that. I like to think of this as practicing self-compassion or grace for yourself, or practicing empathy for another person's situation. And so anytime you find yourself using that phrase, I like to do the 1 to 5 rule. My niece hates this, but every time that little teenage girl at 15 who is thin as a twig says, oh, I'm so fat in this, we call her out and we say, hey, what are 5 things you love about yourself? And eventually she gets pretty tired of that rule, but that's a great way to say, to kind of counter your negative thoughts towards yourself. Or it's also really wise to do towards others, especially as you've already developed an opinion towards others, trying to redirect that initial perception of a person. Okay, and the last one that we're going to talk about is called emotional reasoning. So this is a believing that emotions automatically reflect what your reality is. I feel anxious, so something bad must be happening. I feel like a failure, so I probably am one. Or I feel guilty right now, which means I must have done something wrong and I'm just not identifying what. Before I do the reframing techniques on this, I will say that it is important with especially this one, if there's any trauma base that leads to these thoughts, cognitive distortion, these types of therapy training might not be the best way to approach that. So a lot of traumatic events can be the reason why we might feel anxious in a certain scenario. And that needs to be worked through differently than kind of the reframing I'm going to do. So now we can go on. But with this, like I told you, if you're feeling these things, you're probably in that red zone. You're not thinking logically, your amygdala is on. So before you do any type of reframing, you're going to first ground yourself. There's lots of ways to ground yourself. Mainly it's meaning I'm getting back into that green zone. But one example is that guided imagery, where you name, an example that would be naming 2 examples of every sense that you're feeling at the moment. 2 things that you see in that exact moment. I see a blue sky, I see green grass. 2 things that you feel. I feel warm sunshine. I feel the wind on my cheek. And you go through each. I smell 2 things. I taste 2 things, whatever you can do until now your mind is so occupied on thinking of 10 different senses that you've kind of forgotten about what was emotionally triggering you at the moment. Okay. So I think that gets us through 5 good examples of cognitive distortions. Remember, these are things that you can have whether you're diagnosed with depression or anxiety or nothing. It could just be a sign that mental health needs a little more optimization. You can be a little bit more self-loving to yourself or others. Anytime, though, that you're feeling suicidal or in a crisis, remember it's never too late. Call that 988 number. It is the Suicide and Crisis Lifeline, and it provides 24/7 confidential support to people in suicidal crisis or mental health related distress. Any questions for me today?
I've got a question for you, Mary.
Yeah.
So, like, for you, like, if somebody, like, for supporting others, if somebody comes to you and they confide in that they may be having some kind of health struggle, what do you feel like might be the best way to respond to something like that?
Is it like any type of health struggle, or specifically you're saying mental
Yeah,
health struggle?
mental health struggle.
Mental health.
Yeah, yeah, yeah.
Yeah. I mean, I think the most powerful thing is that's an appointment where you do take the time to listen and get the full picture. Because, like I said, it's so intertwined with physical stuff, emotional, behavioral things. So that's one where you spend a little bit more time listening. Maybe it requires that follow-up visit to then tackle the plan. But I think they first have to be heard. And then from there, deciding on, well, how severe is this, right? Triaging it. Is it a level of we need a psychiatrist? Is it something? There are a lot of handouts you can print off, like cognitive behavioral therapy handoffs that you can actually do as a family medicine practitioner. And maybe you work through a couple sessions with them like that. Get them started, get more comfortable with that counseling technique or therapy thought, and then they might be ready to go see a professional therapist. Or it's possible they could have done that from the beginning. So it's just kind of their comfort level.
All right. Thank you.
Yeah.
Anyone else have questions before we end the event?
Oh, I think I may have one question.
Yeah.
And it's more so about how can you recognize not yourself, but someone that you spend a lot of time around? Will they give you any signs to say, hey, this is not just a bad day? They're trying to tell me something without telling me something.
That's a great question. I think patterns are your biggest friend. Persistency, we all have a one day bad here or there, but if you are tracking and you're thinking, whoa, this is 2 weeks, 2 months, 6 months, well, now we're thinking, well, that's a pattern, that's persistency and a behavioral change, and we might want to reach out for help for that. But in the moment, what things, certainly if it's a loved one, you kind of know they're normal. So if any of those mental, physical, or behavioral changes that we had on that initial slide, I think those are pretty good telling facts. Their sleep is off, their appetite's off, they're more snappy, they're less able to handle what you ask of them. If you're asking for, hey, could you do this for me today? And they're automatically like, oh no, I can't, I don't have time. And that seems to be pretty consistent. I think that's a sign that maybe something is going on, if not a mental health disease, just that they're feeling overwhelmed and they might need to talk about strategies to help. Great question.
All right, Mary, guess you can close it out.
Perfect. Well, thank you everybody for attending. I hope you learned something today, and yes, thanks again. See you later.
Thanks.